he will provide the information to help the providers of services avoid the missteps in billing insurance. Before we start, I will give the thanks to Professor Marilyn Allen. I think that most of the people here knows Marilyn. She really helped our community, like the Chinese speaking practitioners in the passing years. So probably most of the people know she is the editor of American Today, and also know she is the big boss of AAC, which a lot of us get the malpractice insurance firm. But probably not a lot of people know she is also a professor of laws and ethics practice management. And we really appreciate today she put Mr. Sam Collins with our group to have tonight's seminar. So I will give the time to Marilyn Allen. Thank you, Marilyn. Please.
Thank you, Dr. Wei, and thank you for this invitation to speak to your group. I'd like to take this opportunity to introduce Sam Collins. I've actually known Sam for over 50 years. When I met Sam, he was just 9 years old. Well, I was much older than that. But he has worked in this field for a number of years. And right now, he is a member of, I believe it is United Healthcare's Coding and Reimbursement Committee. There are only 9 people in the United States that are on this committee. He meets with this large insurance company at least once a quarter, and Sam, you can correct me anytime. And he is very knowledgeable in insurance. He also serves as the #1 liaison to the Veterans Administration through the Office of the Inspector General. So when there is an issue with acupuncture and veterans, Sam is the one who answers the questions and does the consulting. Sam also has served for the last few years with me on the WHO committee for your new codes. And approximately 3 years ago, when the WHO was training the health providers of the world who work at WHO, who volunteer, we were having a lesson on how to code with the new codes, the ICD-11 codes, of which traditional medicine, chapter 26 is part of it. And they would give a little short input on an issue, and then they would say, please code this. And every time we had to answer it, Sam was the first one who answered and had it all correct. Sam is extremely knowledgeable. He also offers a service called the AAC Information Network, and we can talk to you about that later. We're also going to talk to your particular associations, because I think we might have some kind of a discount that we can put together for you. So if you have a question about insurance, a question about billing, a question about any type of thing that you need that relates to this, Sam is the person that you want to get your information from. I'm also going to say that NCCAOM and other places that have to do with answering questions about your medicine are receiving calls almost every single day from patients around the country asking, my acupuncture won't take my insurance. Can you send me to someone who will? Let me say this, acupuncture helps a patient pay their bill. That's all. And I know when we started, we didn't have any insurance coverage. but almost every insurance company now covers. Why? Because they know the medicine works and it is so powerful. So it is my honor to introduce you, Sam. I'm very happy that you just decided to do this with us. Thank you. And here's Dr. Sam Collins.
Thank you. That's all very kind. And I thank everyone for taking some time out. And here's what I'll say to you. Think of how important is your practice when you are giving up a Sunday evening to hear about something that you probably thought, I never want to bill insurance. And yet now you're giving up a Sunday night for it. And that's how important it is to you and it is to me. So I want to make sure to try to provide you with some information that'll make it digestible, that'll make it that you can understand it, and it won't be overly complicated. One of the things I'd like to do in this next 2 hours is to try to give you enough information that you can begin to comfortably and correctly bill, which means a patient has more access. Let's face it, what is the number one thing that most people don't come to an acupuncturist for? That number one thing, the barrier for them coming, is money. So what I want to try to do is to try to increase your ability to have a patient have lesser barriers to come in. Because most often where people have problems, it's just the money. So that's where we get into billing and coding. Because let's face it, how many more people could you see if they all could afford it? So I want to try to make sure we have a good understanding of it. It's not as complicated as people make it seem. It's actually pretty straightforward, and that's what we want to try to do. Now, this is going to be, for some of you, maybe some new information. So I'm going to suggest follow along with me. I'm going to have a slide presentation. And then this slide presentation, I have sent over to them in a PDF format that they can email to you. So you can have this same information, because my goal is from just this information you're going to receive tonight and the handout, you'll be able to competently bill and begin to get your patients more access to the type of care that you deliver. Now, I'm very excited about acupuncture. I'm not an acupuncturist, but I'm a coding and billing expert for acupuncture, as Marilyn noted. At the same token, I know what all of you go through. There seems to be a line of people lining up for pills and surgery, but not about healthcare. And there becomes the difference. When we hear the term health insurance, is it really health insurance? Is that what we think of? Not really. It's more you got to be sick. So here's something that's really positive. The growth of acupuncture has been exponential. I've been working with Marilyn now since, like 2000 for acupuncture. So for the past 22 years directly for this. And one of the things we're very pleased with is the update across the world of acupuncture. Obviously, a lot of Asian countries use it, but it's becoming more and more acceptable everywhere, because the bottom line is, and you know this well, acupuncture works very well. The problem is sometimes it's hard to identify. And so I want everyone to see here, take a look. You'll notice it talks about the new information here in ICD-11, and it's traditional medicine chapter. That's myself here. This is Marilyn. These are delegates from China, from Japan, but also countries like Australia, Denmark, and others, because the idea was they realized acupuncture works and works well, but they realized they needed an ability to count acupuncture in ways that acupuncture counts itself. So what they developed is traditional medicine diagnosis. Now, this is not coming right away, but this is the movement of the world towards this, where they're beginning to understand that acupuncturists don't categorize everything in Western terms. So by example, this traditional medicine chapter, there's a whole chapter in ICD-11 for it, will specifically have something that's called the disorder and the pattern. So constipation will still have its Western diagnosis, constipation, but then it talks about the types of things that will develop. And so you'll notice here, it talks about the patient has a history of constipation. Stool is basically once every 3 to 5 days, aggravated in a month. She had no dry stool, but is easy to defecate, hard work, lassitude, poor appetite, tired limbs. I want you to think of that for a second. That's not something a traditional Western medical doctor would look at. The tongue is pale and fat with tooth marks on the edge and a thin white coating. That's going to give you a different way. Obviously, a lot of people have constipation. So we're going to say, yes, there's constipation, a constipation disorder, but here's one specifically with spleen deficiency and chi stagnation.
This is
I see.
can
Function.
diagnosis is not before the cold, right?
Yeah.
It's not just pain.
No, bear with me. I'm giving you an introduction right now. This is the acceptance of acupuncture. It's more than just pain. A lot of it is, but it's more than that. And that's what I'm trying to point out, this growth of the world acceptance of acupuncture. And I'm going to show you some insurances that will exactly pay for this type of disorder, not just pain. So it's not limited to pain anymore. What I'm trying to emphasize here, though, is the growth. Think of 10 years ago, 20 years ago, where acupuncture was on the world stage compared to now. It is so popular now, they have to come up and say, we need to decode it to make sure that we can count it. So by example, even though that's the international classifications, even in Western medicine, I'm sure when you hear something from a company called Evacore. Evacore is the company that is behind the scenes for your big Blue Cross Blue Shield and United Healthcare. And you'll notice in their section dealing with back pain for acupuncture, it talks about it from a standard Western size, low back pain. But notice on the traditional side, stagnation, underlying conditions. And notice this one, B syndrome. Accumulation of cold and damp can result from lifestyle choices such as irregular or incorrect food choice, irregular eating times, lack of sleep, or external pathogens. So think of this for a second. Look at the growth of where acupuncture has come, where everyone said it was pain management only. Notice now how they're categorizing it. So it's beginning to have a better understanding of what you do so they can look at the outcome. Because I'll ask a question to see how well you do it. You have a medical doctor, a chiropractor, a physical therapist, and an acupuncturist all treating back pain, low back pain. Who has the best outcome of those four professions? Statistically, it's actually acupuncture.
Sure.
Now, how many acupuncturists know that and or promote it? Yet most people think about going to chiropractors, but actually acupuncture has a slight edge over chiropractic with back pain. So the difference is, this is why acupuncture has moved so far forward. And part of the reason Medicare is covering acupuncture. Now, I want to clarify, Medicare has limitations for acupuncture only for chronic low back pain. For nothing else, chronic low back pain. Now, the problem with this is this service for Medicare, or what we call regular Medicare, Medicare Part B, is limited where an acupuncturist may do it, but has to be under the supervision of a medical doctor. So that's something you've all probably run into. Patients call you and go, I heard I have acupuncture benefits. Well, if it's straight Medicare, you still need the supervision of a medical doctor. So let's make a clarity to this. You have to be working with the medical doctor. It is not a referral. So that means you will be working in the same office. Either you work in their office, they work in yours, but you can get up to 20 visits per year. The Medicare reimbursement now is well over $100 per visit. So this is something that's viable. And why did they do this? Because acupuncture works. And the assumption is it will save the system money, if you will, the Medicare system. But this is Medicare Part B. This is what they're putting out. The company AARP putting out Medicare will cover acupuncture for chronic low back pain. That's why all your patients are coming. But let's make sure they understand if it's regular Medicare, it's limited to supervision by a medical provider. Now, keep in mind that medical provider would be a medical doctor, also could be an osteopath, but it also could be a nurse practitioner or a physician assistant. So there may be a lot of latitude for you to work within a grouping like that. However, there's something really good. Take a look at this, and I want you to think of this for a second. They are now using acupuncture to advertise for people to buy their insurance. This is called a Medicare Advantage plan. It's Medicare, but not by regular Medicare, Medicare Advantage or Part C. This particular plan with United Healthcare has a $0 copay. So do you think that patient has a very big barrier to come to see an acupuncturist? They don't. So keep in mind, this is access you want to work with. Regular Medicare can be a little bit tougher because of the supervision need. But if it's a Medicare Advantage plan, those plans will pay directly and the patient has no copay. When they come in, you accept the patient, the insurance basically pays in full on what they allow. But assuming you're doing 3 sets of acupuncture and a therapy, it's a little over $100 per visit, not including exams. The other growth of acupuncture is every insurance company is advertising. Take a look at this one. Clever Care is advertising their benefits for their Medicare Advantage. Notice they're using a picture of an acupuncturist. Look at the growth of your profession that now you're part of their advertising, including, of course, the VA. Now, depending on what part of the country you're in, it's going to be Optum Health if you're basically east of Texas. But if you're Texas and west of Texas, it's going to be under a company, TriWest. But it gives excellent benefits for acupuncture, direct access, direct payment. So you want to think for a second, those ones I just showed you are ones the patients don't have to pay anything out of pocket. So we have to make sure we have a good understanding of what really is insurance. Oh, and one more. I took this from the show Good Morning America on ABC. And you'll notice the prescription for wellness. They're not even talking about necessarily pain, but saying non-medication. And notice 2 of the 3 things are something you do. Acupuncture, herbs, and essential oils, but obviously you do hot and cold packs too. But notice even these shows are beginning to see the value of your service. So here's what we have to do. Create access so people can come to you. I mean, let's face it, what really makes a practice do well is you can help people. The more people you can help, the better you like it, but also the better you're paid. So I'm always thinking of what is a barrier for someone coming in. If you ask yourself and ask most people, when you ask them if they go to the doctor, most people will say, well, yes. But when you ask them if you don't have insurance, do you go to the doctor? They mostly say no. I bet all of you probably know someone who needs to go to the doctor, yet doesn't go because they don't have insurance or can't afford it. So I want you to think in these ways. If you're doing a full cash practice, you've limited yourself to the least number of people because 80% of our population, close to 90, have health insurance and many have acupuncture benefits. So we want to learn to access it. So what I want to do is try to give you a feeling for what are the better plans that are out there, what are ones that aren't so good. And remember, just because you bill one insurance or take one insurance doesn't mean you have to accept them all. So you might say, I take Blue Cross, but I do not take Cigna. That's completely up to you in your area. You're never bound that you have to bill unless you join as a provider for these insurance payers. So let's talk about insurance. What is health insurance? Is it really health insurance? It's not. They have to be sick. Something has to be wrong. Therefore, it's not preventative. And you want to think of it simply. An insurance helps to pay for your bill. Some insurances might pay all of the bill, don't get me wrong, but it's mostly helps to pay. Patients always have to pay something, but if you think of it, if you told me I needed to come 3 times a week and it cost $150, I'm paying $450 a week, how many people can afford to pay $1,800 in 1 month? I don't think very many, particularly right now with the way our economy feels and gas prices. So without insurance, they're probably not going to go. So tell a patient they need 10 visits without insurance, they probably come for 2 because they feel a little better. But if they have insurance and you recommend 10 and their insurance pays most of it, are they more likely to come? What if a person only pays $20 or $30? What we're trying to do is create access. So insurance really is something you should integrate. You do not want to be exclusive. If I have really good insurance, and I can tell all of you that Marilyn and I have very good insurance. Our company, we work together. Our company pays for a good health insurance policy. Now, I have to pay a good chunk of it, but my insurance has no deductible, and I have no copay, and I'm not kidding. So therefore, it's a really good plan. So I would think if I came to your office, you would say, no, I don't take your insurance. If my insurance would pay you in full, wouldn't you? And the same would apply. I'm going to take good insurance, but I'm also not going to take money from people who can't pay me. Think of it. You have a cash practice. Do you let every patient come in? No. You don't let the people who can't pay you. So I want you to think of insurance in the same way. You're accepting people that need your care, but that can also pay for it. I mean, I would love a practice where I could just help everyone, but then who's going to pay my bills? And so that's why we have to create a business model. And what I'm going to suggest is to have a practice that has both. People more often go to doctors when they have insurance. Just ask your friends. Ask them, do you go to the doctor without insurance? And you're going to find invariably most are going to say no. So we want to make sure we're accessing that type of benefit. Just keep in mind, insurance aids in payment. It rarely pays 100%. Now, there's some things that do. Now, for those of you in Florida, you can't do personal injury or car accidents, but outside of Florida, acupuncturists can treat car accidents. That could pay 100%. Workers' compensation, the VA. some health insurances, but I'm going to say most health insurances probably pay about 60 to maybe 70, 75% of your bill. Well, that's a lot better for a patient to come in if they only have to pay 20 to 30%. You know what you're looking for? New patients, people to come in, people you want to help. I think most people are more accepting to try something when they have coverage. And here's the good news. You're not required to bill insurance. And don't be afraid to tell someone, oh, I'm sorry, I don't take Aetna or I don't take Blue Cross. That's completely up to you. And I would suggest do just like medical doctors. They've done it longer in this country than you have. Whenever you go to a medical office, do you ever notice it doesn't say all insurance accepted? What does it say? Insurance accepted. They never give the feeling they're taking everything. The particular doctor I go to, he has a practice that he doesn't take any of the HMOs and PPOs. If you have that type of plan, he won't accept the insurance. You may still come to him, but you have to pay cash because he doesn't take your insurance. So you can always have some with insurance, some without. And I'm going to say to you, there's nothing wrong with choosing people who can pay you. I mean, think of any business. Can you go get gas when you don't have money? So they only choose to give gas to people who will pay for it. I want you to think of your business in the same way. Now, the confusion comes in when people go, well, what type of insurances are there? So let me give a quick primer of what you kind of run into. There's standard health insurance, and that's what most people think of, where it's insurance. The insurance has a deductible, maybe it's a few $100s, and the insurance pays 80-20. That insurance is not very popular because it's more expensive. Patients can go anywhere they want, though. When someone has a PPO, or preferred provider organization, that's a plan where the patient can choose to go to any doctor, but if they go to a preferred provider, they have to pay less out of pocket. So if you think of it like any business, if you could go to a store and get the same item for cheaper than another store, you would probably go to that store. So this is why sometimes we may want to join plans like this because it makes it more attractive for people to come, so long as it's paying a reasonable amount. Then we have HMOs, health maintenance organizations, and these are pure where the only coverage they have is going directly to the HMO, like Kaiser, if you're familiar with that, or HealthNet. Those are plans when the patient has insurance, while they have benefits, they have to go directly to that doctor only if they want to use that benefit. Now, acupuncturists don't have HMOs, so you might think, well, how does that affect us? You can join through a lot of insurances. By example, if you join the company ASH in some instances, it'll get you involved with these. But remember, there's always a trade. When you join something, it gives you access to a patient, but likely far less money per visit. So that's something to consider is whether that's worth it. It could be in some instances, and for some practices, I'm going to say yes. Another way a person can use insurance is something called an HSA, or a health savings account. And what these are actually savings accounts that people have through their employer that help to pay for their healthcare services. It can pay for deductible and other out-of-pocket costs, but a person can use that directly to go to an acupuncturist. So if you only took cash, this would be still something good to take because it's a debit card. They use it directly. There's also automobile. Every state except Florida, you can treat someone from a car accident. Well, you still could in Florida, but the patient has to pay cash. There's no insurance reimbursement. But in most states, Wisconsin being one of them, if a person's hurt in a car accident, can an acupuncturist be their primary provider? So here's a business I want you to think of. Statistically, all of you are going to have several people that are patients in your practice currently in the next month that are going to be in a car accident. They're going to have something called PIP, Personal Injury Protection, or MedPay that could pay your bill directly and in full. But are those patients aware they could come and see you? I think part of the problem is, how do people know what we do if we're not out there letting them know? Have you ever told any patient, if you're in a car accident, what if you have a patient that really likes you, that you've been the person that helped them the most? They're in a car accident. They don't think of you because they thought, oh, I have to go to a chiropractor. So I think part of our problem is letting people know, yes, we do take these plans. The same in workers' compensation. If someone's hurt at work, they can directly see an acupuncturist, and it can pay quite well. The same applies with VA, called Veterans Administration, or VA meaning Veterans Administration, but it's called VA Choice. You do have to enroll, but this plan can be quite generous. You generally are going to get 12 visits. And for those 12 visits, that reimbursement is about $2,000, assuming the typical services most acupuncturists do. So that's certainly what I would take. And these two here don't have any money paid from the patient. How nice would it be to have a person come in, you get paid $150, they have to pay nothing out of pocket. Do you think that might be something they would want to access? Absolutely.
Yep.
How about Medicaid? Now, Medicaid, I want to be careful. Some states are better than others, but it's generally very low paying. So you have to work pretty efficiently, because I would say the reimbursements here could be as little as 30 and maybe as much as 60 a visit. So you have to be high volume. Not a big fan of this one, but again, to fill in some gaps, maybe. And then, of course, as I mentioned, there is Medicare. But remember, Medicare Part B, standard Medicare, it must be under supervision of a medical provider. Medicare Part C is the one you can have direct access. And you'll know because they'll have a card, it'll say Medicare Advantage on it. What I'm going to suggest is I'm going to take some of everything here, just not all of it. So let's make sure we have an understanding what we're looking for. Patients, that's what we want. We want to help people. That's what you do well. So when someone comes in, whether they're paying cash or insurance, let's not even talk about insurance yet. If someone's coming in as a patient, what do we need to do? We need to make sure they understand what the costs are. So don't you let people know if they're paying cash, your visit's $100, or how about if it's an insurance? So the first thing with any patient, we get a financial understanding. How are they coming in? Are you going to be using cash or insurance? If they're going to use insurance, we want to make sure we have a good understanding. Remember, insurance helps to pay for care. It often doesn't pay for everything. So the understanding is we'll bill your insurance. And maybe for every $100 we bill, your insurance pays 75 of it. Therefore, they pay 25 a visit. But again, more attractive if they have someone else paying for it. Think of it like a parent. Would a child go anywhere without their parents paying for it? So in a way, insurance is kind of that. So if you're dealing with insurance, though, the one thing to do is verified benefits. You know what you want to know? Does it have acupuncture benefits? Do you know more and more policies are covering acupuncture? And you know why? They're figured out acupuncture works. The sole reason that acupuncture is in Medicare is because they first were going to do a study of acupuncture and not pay everyone for it. But the evidence was so overwhelming, they said, let's go ahead and do it. The problem was that was before acupuncturists became part of the Medicare system. Now, the good news, there's a bill already set up now to get acupuncture fully in. My hope is before the next administration that will get signed and acupuncturists will have direct access. So that should be coming. We'll have to wait to see. But it's important for you. This is why you join your state association and national associations, because those are the people that are fighting on the ground to get that type of thing out there. So we verify benefits, making sure it has acupuncture. Now, here's the really good news. For some of you who have been in practice for a while, you probably remember this. There was a time that insurance companies could say they cover acupuncture, but not pay an acupuncturist. They could literally say, nope, we don't cover it unless it's an MD. That law changed under President Obama in what's called the Affordable Care Act. So while we may not like everything about the Affordable Care Act, we certainly don't want it to go away because it gave you full benefits, meaning if there's acupuncture benefits, it has to be paid to you. And the same applies. Let's say you're in Florida and you're doing injections. Being that injections are part of your scope of practice, the insurance company has to pay for that benefit as well and cannot discriminate. So you got to verify, what does the plan cover? Physical therapy would cover as well. When the patient comes in, what do? We evaluate them. We examine them. We make a diagnosis and you treat them. And then you send a claim. So I want you to think of it. Everyone who says insurance is hard, I want you to see all you have to do. You need a patient. If they have insurance, you verify there's acupuncture benefits. Not too hard, phone or by internet. Then you examine them, you figure out what's wrong, and you treat them. So this is like you do with everybody. The difference is you send a claim to an insurance, and you should get payment. Most payments should be in about 30 days if everything's done correctly. So the number one thing is you got to have a diagnosis, and this is going to be an emphasis for me, for all of you. Your diagnosis plays a very large role on whether you're going to get reimbursed. So what I'm going to give you in this next few minutes are a list of codes that are payable for acupuncture. Now, you might say, but Sam, the codes or the things I treat aren't on there. Well, that's fine, but it means it's not going to be paid by insurance. So what I'm emphasizing here is I'm giving you the list that is paid by insurance. So what you want to try to do is stick within the list. Now, here's the beauty of acupuncture, what I call the full genius of acupuncture. I think acupuncture is purely genius, and here's why. Whenever someone has a disease, and I'll say a disease of almost any type, what is the symptom that they always have with disease, almost with anything? Pain. And so for the most part, when you're going to be coding for insurance, always think pain. It's more than that now, but I want you to start with the onus of pain. Now think of it, what does acupuncture do? Acupuncture listens to a person's pain and then treats, but that pain doesn't mean it's just here. I mean, if you have pain in your shoulder, could that be your gallbladder? Absolutely. So we're looking at more than just simply that. So I want to focus in on pain or symptoms and signs, and those are the acceptable, generally the most payable code for insurance reimbursement is going to be pain. You're going to see the majority of codes I give you are going to have that, but there are many that are not because there's been more and more updates to this. Now, I do want to make an emphasis, and this is something that's really big for myself and for Marilyn, and I think for the profession. I would like all of you to always include your traditional medicine diagnosis. Now, I don't need it on the claim form, but I need it in the notes because what I want to do is to make sure this profession and this medicine is separate from what people call dry needling. I did a program with physical therapists not long ago, and they're indicating now that 80% of physical therapists are dry needling. Now, that was of the people surveyed, but that makes me fearful of people who go to a physical therapist and get dry needling and then want to say, oh, I had acupuncture. No, you did not. Dry needling does not follow the principles, the style, and none of it. So I want to be very clear. So in your notes, please put down things like chi stagnations and deficiencies, whatever it is, so that there's a clear understanding that it's not just simply palpating a trigger point and inserting a needle. Now, when it comes to diagnosis, they're international, which means you're going to use letters and numbers to describe them, and they can be from as little as 3 to 7 characters. So when you see this term highest level of specificity, all that means is use the right code. Notice R52 is a complete diagnosis code. It just means pain generically. But if it's pain in the neck, it's M54-2. If it's radicular pain, radiating down the arm, it's M54-12. So all I'm pointing out, make sure when you put a code on a claim form, the code is correct. Now, this list I'm going to give you coming in just a moment will all be accurate and complete up to this year. And so now you can see here, and I'm going to blow this up here and make this larger so it's a little easier for everyone to see. Let me bring it down. There we go. You'll notice the codes, and what I'm going to do here is start from head to toe. You'll notice right off the bat, what are the codes of the head that are covered? Well, of course, there's headaches. But notice these codes indicate new. So one thing to keep in mind, I want everyone to know, diagnosis codes can update every October, not January, in October. So please check with us at American Acupuncture Council around September to know what the updates are. Because, for instance, this year, this is a brand new code for a cervicogenic headache, but there's also new codes for low back pain. So what I'm putting on this list here, and I'm going to make this very clear, every code that I've put on this list that I'm going to show you now are payable by insurance. I'm not saying that each of these are payable by every insurance. I'm going to show you some nuance to that, but at the same token covered. So notice for the head, things like headaches, chronic headaches, tension headaches, migraine headaches. But notice also things like jaw pain, TMJ disorders. So you know someone can have a TMJ problem? Acupuncture is paid for that, including things like arthralgia, myalgia. But then, of course, you have the standard stuff you're all used to. Neck pain, myalgia, muscle pain of the neck. Notice radiculopathy. Now, you might say, oh, Sam, I can't make that diagnosis. Well, a lot of you may not be in a state that allows you to make a differentiated diagnosis, but how about a patient coming from referred from another doctor? They're going to have these codes. And would we all agree, would someone with radiculopathy have neck pain? I'd say yes. But would you say someone with radiculopathy is more severe than cervicalgia? I would also say that. So I want to try to also use a code that dictates the level or seriousness of it. Notice even codes for disc disorder are included. Now that might be a little far-fetched to some of you, but I want you to think for a moment, how many times does a patient come to you from a referral that has these type of conditions? So now let's blow up this page here. This next page, you'll notice a continuation. And we've got all these codes for the neck, all these disc injuries, disc degeneration, disc disorders. But notice also at the very end, just simple strains and sprains. Now you may think, oh my goodness, Sam, that's a lot of codes. It is. Will you likely ever use some of these? Maybe not. Maybe you'll just use neck pain. But at the same token, the availability with some carriers may be a little more wide open because that code might be a little bit better. Notice I'm doing the same thing and I'm going down what we call the axial skeleton, meaning the axis of the body from head to spine. Then we'll do the extremities. Notice thoracic spine, upper back. There's pain, radiculopathy, sprains and strains, but notice things like intercostal pain, pain between the ribs, or just chest pain. Now, not the chest pain of a headache, but chest pain. And then we have, how about for lower back? Notice for low back pain, we have some new codes now. There's low back pain that's just unspecified, meaning not really sure why it's there, it's just hurting. But then we have one that says vertebrogenic, meaning caused from the spine, or something other like pregnancy related. But then notice the same pattern, radiculopathy, sciatica, sprains and strains as well. Now, obviously, there's more than just the back. Every joint has a pain code. Every joint. Shoulder down to the foot. How about if the pain is not in the shoulder or a joint? Notice pain in the arm. So what I'm trying to show you here, and I don't want to bore you just by bringing you through a boring list of diagnoses, but notice everywhere you could have pain, there's a code. So always try to think of, at the very least, that's what you're going to code, unless you know it's an insurance that will allow you to do more than that. But notice every single place. Well, I want you to look at these codes. How about arthritis? Arthritis. Notice arthritis is listed based on the body area. Now, if you think of it, though, what does arthritis cause? Yeah, you got it, pain. But nonetheless, arthritis would make a little bit more specificity. How about some miscellaneous codes? Things like adhesive capsulitis or bursitis of the shoulder. Those could be painful, but those are cover codes from some payers. Let me go ahead and blow this up again here. Notice we even go further, like condylitis, meaning tennis elbow, golfer's elbow, carpal tunnel syndrome. Notice things like tendonitis and psoas tendonitis, iliotibial band, Achilles tendon. But notice these codes at the end, plantar fascial fibromatosis, plantar fasciitis, restless leg syndrome, neuralgia. Or how about just pain? Notice all the codes for pain. Pain syndromes everywhere. How about muscle pain codes? Myalgia is more severe than cervicalgia because myalgia tells me the muscle is hurting and it's slightly more specific. Now, some carriers may not accept that though, and that's what we'll get into next is we'll see all the differences. Now, here's one area. If you have a practice where you deal with nausea and vomiting, pregnant women or otherwise, I will tell you every insurance that covers acupuncture always covers nausea and vomiting. Always. That is number one, always covered along with pain. But I want you to look at an interesting code here. T45-1X5A. And you might look, wow, that sounds really scientific. You know what this code is for? Chemotherapy-induced nausea. Notice what the code says. Anti-neoplastic immunosuppressive drugs, meaning chemotherapy that causes nausea. But notice we also have vomiting of pregnancy. And how about these? You might think, hey, wait a minute, Sam. You're telling me they're going to cover menstrual issues for women? Yes, some insurances do. So notice all of these codes, but notice even things like infertility. And how about even menopause? Abdominal pain has its codes. So again, all I'm doing is taking you through each area. Everyone's going to have access to this list because you're going to get a copy of it. Notice all the other things for abdominal pain. Wait a minute, Sam, you have constipation, functional constipation, irritable bowel syndrome. Yeah, those are covered. Take a look at these, though. Panic disorders. How about PTSD, post-traumatic stress, depression, eating disorders? You're going to think, whoa, I can tell you in the state of Washington, their anthem policies cover very, very well for mental disorders. Usually you're getting a referral directly from a mental health professional, meaning a doctor of that type. But at the same token, getting a lot of good work there. And you're going to think, wait, anorexia too? How about cancer? Now, let's be careful. I'm not talking about you're treating cancer. I'm indicating you're treating the effects, the nausea, the vomiting, the pain that may be associated. In addition to that, how about these? Allergies, bowel issues, adjunct post-stroke. Whoa, wait a minute. Are you saying patients with a stroke? Yes. You're not treating the stroke. You're treating the other things associated with it, such as facial weakness. Now, you may say to yourself, well, Sam just gave me a lot of codes. Remember, I just told you every single one of these codes are covered by insurance. Just not every insurance covers. So what this is a compendium, a list of everything together. Now I want to give you something slightly more specific to each carrier. So let's talk about specific acupuncture coverage to national carriers. I don't care what state you're in. What I'm going to show you is the coverage for these particular plans. But here's something I want you to think of as a business owner. What do people think you do? I would love for you to just ask anyone, random people, even your family though, and I mean it. Ask your mom, your sister, uncles, whomever. Ask them this question. What do you think I do? And don't bias them. Let them say whatever. Then I want you to think of, ask a random stranger, what do you think acupuncture does? And I think what you're going to hear is a lot of ignorance. Now, I'm not blaming them. I'm saying we have to do a better job. Think of the things that you treat as an acupuncturist that people are not aware of. Here's two different offices. One, this is a sign they have in the hallway because they're inside a medical building. This one is just outside of their office. Notice what this office is telling people. Fatigue, stress and tension, anxiety, depression, mood swings, migraines, tension, digestive disorders, allergies, back pain, neck pain, women's issues. You know what this is doing? Informing people. If you're good at treating headaches, what if I were to Google acupuncture in my neighborhood, would your name come up? If I said, can acupuncture help headaches? I hope you have something on your website that talks about headaches, because that's how Google puts things out. So I'm going to suggest if you are not doing this, you're missing out, because people go by your office. If they just see acupuncture, remember, they're ignorant to it. We have to do a better job of educating. Think of what are you putting out there. Here's an office that does it. Nope, neck and low back pain, stress, depression, anxiety, insomnia, sciatica, tendonitis, Bell's palsy, weight control, PMS and disorders. And it even talks about disposable needles only, make people feel safe. I think we have a problem in our profession. We have to be better at getting out so people know what the heck we do. Think of how many times a person has come to you, and I know this has happened to every single one of you. Someone comes in, they don't even think what you're going to do is going to help them, but they say, what the heck, my friend said I should try it, and I figured why not, since my insurance covers it. Then they get the treatment. And then they're like, oh my God, I can't believe it. I had a headache for a week. I come to you one time and it's gone. That's happened to each one of you. What have we done to have people see that? We've got to do a better job of making people aware we're not just pain. Yes, that's part of it, but it's so much, much more. So now let's take a look at individual plans. This is Aetna. I do not care what state you're in. This is how Aetna covers acupuncture. Take a look. The policy had a review this year. They haven't published the new one yet. Once it does, I'll put it out there. I don't think we'll see a lot of change, maybe a little bit, but I want you to see what it says. Aetna limits coverage of acupuncture used in lieu of anesthesia on most plans. Uh-oh. You know, that's not actually true. It's some plans. I will tell you, as of this year, and you can go to our website, which is AAC Info Network in the news section. Do you know all commercial plans of Aetna, as of this year, cover acupuncture? Every single one. Unless it's one through the federal government, it is covering acupuncture. And how do they cover it? Well, here's what they cover. They cover neck pain and headaches, but they've got to be chronic. I think that's what's going to change. But they cover low back pain. That's actually new, low back pain, because it used to be chronic. That's why I think this is going to change. Nausea of pregnancy, arthritis of the knee or hip, postoperative chemotherapy-induced nausea, dental pain. Whoa, you mean after I get dental work or get a tooth removed, they'll cover pain for that? Yes, not the dental insurance, Aetna. And TMJ disorders. Well, that's fantastic. Here's the problem. That's a good list, but is that a very big list? It is not. So let's take a look at what codes they actually cover. So now let me blow this up so it's real easy to see. And you'll notice right off the top, it says, these are the codes that if the selection criteria is met, meaning that it can be helpful. But notice parenthetically, it says not all inclusive. That's their tricky way of saying, we will 100% cover all these codes, and we may cover more, but we're not going to tell you. Well, I'll tell you what those are, or give you a hint towards it. But what I will say to you is this. If you bill Aetna, and it's one of the codes what you're seeing in front of you right now, I'm going to guarantee you get paid by Aetna, no questions. It covers all the migraine headaches, pain in the teeth, arthritis and pain of the hip and knee. Also arthritis of the knee and hip. Now, wait a minute. Sam, it's covering hip and knee. Why not the shoulder or the elbow? Well, I will tell you, actually, now they are covering the other joints. So that's the not all inclusive. If you give me pain of a joint, along with these, that'll be covered. But it also TMJ, and then you'll see here all the back pain codes, neck pain codes, nausea with vomiting. Notice they cover vomiting well and headaches. So is this a pretty good list? I say, yeah, that's good. But is it very big? No. Notice some of the codes I have, like depression, that's not on there, is it? Anxiety? No. So know that Aetna is going to be kind of a musculoskeletal type. But notice there's no strain sprain. So how would I code that for them? Well, let's talk about that. Let's move to our next plan. Let's talk about Cigna. And again, I do not care where you practice. This is Cigna across the country. Cigna is a very good payer of acupuncture, but let me blow this up so it's easy to see. And don't forget, all of you are going to get a copy of this. The next review is in about a month, or no, about 2 weeks. I don't think anything's going to change, but notice immediately the difference here. Tension, headaches, musculoskeletal joint pain, hip and knee, nausea, and so forth. So they're going to have a much better coverage. And you'll see that because take a look at this list. You can immediately see this is the list that is Cigna compared to Aetna. So the first thing you'll notice, this is single spaced. And you'll notice right away, wow, migraine headaches, but all of them, G43001 through 919. That's a lot of codes. All types of headaches. Acute pain due to trauma, post-procedural pain, neoplasm related. But here's a code I want you all to see, G89.4, general pain syndrome. A syndrome is when there's pain, most of us develop kind of a depressive syndrome. I want everyone to think, if you were sick for 2 weeks, would you start feeling a little depressed? Now, I'm not talking clinical depression, but depressed. That's what this code is for. That syndrome is those things that everyone gets when you don't feel well for a while. Now, this insurance is saying, look, we're going to pay for this. Now, if you were to use these codes for Aetna, would they pay you? No, but Cigna will. And notice the difference. Arthritis of every joint, including pain in the shoulder and every joint. In fact, I'll go through this relatively quickly and move to the next page. You'll notice that pain code continues everywhere. Oops, I went too fast. Continues everywhere. So, oh, I still went too fast. Excuse me. Let's go back. So you'll notice here pain in the knee, all through the joints, and then spondylosis. Now, if you're not familiar, spondylosis is the fancy word for arthritis of the spine. I want you to think of how many people over the age of 40 probably have arthritis. A good number. So why do you think most people have chronic neck and back pain? Because most of us are arthritic. We live a long time. By example, you probably notice I'm bald. I can't help it. As everyone in my family gets older, they lose hair. Not everyone, the men in the family. Well, not my sons because they have Asian heritage, but at least on my side. But bottom line is, as you age, things happen. People that are older are going to experience more neck and back pain because of arthritic changes. That's why they're allowing it. Now, again, let me go through here. You'll see stenosis, everything for disc, and you're going to go, wow, this is really good, Sam. All of these codes are covered by Cigna. They are, but you're going to go, Sam, I can't come up with this diagnosis. Well, no, you're not going to send out for x-rays unless you're from California. By the way, acupuncturists in California can order x-rays and MRIs, CT scans too. Nonetheless, how many times have you had a patient with a chronic condition that has been to a doctor with this type of diagnosis? Would we all think of, if someone has a disc that's herniated or displaced, would that be a patient that needs more care? They would. Therefore, this code is better to get the adequate amount of visits. Notice I didn't say more. I said adequate, meaning I want the right number of visits. Maybe that patient needs 6 months of care. If I just said back pain, it might not be as conclusive. But here's a good question for you. What if you had an Aetna patient with a herniated disc? I mean, that disc is putting a lot of pressure. How would you code that patient? I want you to really think about that. How would you code an Aetna patient for this condition? Well, I hope you're thinking like me. What is the symptom that someone's going to have when they have a disc displacement? Pain. So what are you going to have? A pain diagnosis for the neck and back. So while these are really good codes, you could still get by with others. Notice even things like myalgia as I put together. But notice this list here, pain in every joint. They even let you use, you ever heard a chiropractor use the term subluxation? Acupuncturists can too for Cigna. So when you look at this list, you'll notice, wow, Sam, it covers almost everything. Notice vomiting, intercostal pain, headaches. And here's the next thing. All of these codes that have an S are sprains and strains. So I'm going to make a very broad statement. If you have a Cigna patient with any type of sprain or strain, whether it's direct trauma or repetitive use, you'll be covered because they literally cover every strain and sprain. And I'm not kidding, because let me get through the list. There's 1, 2, 3, 4, 5 of these pages. And there's about 45 codes. That means every joint. So if someone says to me, Sam, I'm not getting paid by Cigna, I'd almost say, what are you coding? Because this is pretty easy when you look at this big list. So here's how I want you to frame this. If it's an Aetna patient, you're going to use the Aetna list. But if it's a Cigna patient, it's an even much broader list. And so always kind of know who you're dealing with and the type of coverage they have. These are two very popular ones. But let's talk about the next one. This is that company earlier I talked about, Evacore. Now, to give you some background, as Marilyn mentioned, I'm on the Reimbursement and Coding Committee for United Healthcare Optum Health. And in one of our meetings, I found out that Optum Health owns Evacore. But Evacore is the company that reviews everything for Blue Cross. So I thought, wait a minute. The company who reviews Blue Cross is owned by Optum? Well, guess who owns Optum? United Healthcare. So sometimes I wonder if we already don't have a single payer of insurance, frankly, because of the connection between all of them. Now, the good news is I would accept this in a heartbeat, because look at the difference here. Now, you look at this page, and you might say to yourself, well, Sam, this looks pretty much like the code you just gave me. Neck pain, cervical cranial syndrome, migraines, brachial neuritis, sprains and strains, cervicalgia. It is pretty much. That's where I get the list. But the big difference when we get to this one, beyond the extremities, take a look here. Not only myalgia, fibromyalgia, and all that stuff, but notice cancer, mental health, post-stroke, rhinitis, constipation, prostatitis pain. Generally, if you're dealing with United or Anthem, the blues, you're going to see a lot of different coverage. Notice they cover menopause. Now, I want everyone to think about it. Does menopause cause pain? Now, I'm a male saying that, so I want to be a little bit careful. But does menopause cause pain? Tangentially, maybe, but here's what I know about menopause. And this is for any man that's listening right now. Let me bring myself up back to a big screen here. I think I'll be back to a big view here. What I want you to think of, if you have a spouse, a friend that's going through menopause, you're going to know it, because one day you're going to be sitting at home and your spouse or your favorite person will look over at you and go, are you hot? And you think, what do you mean? She goes, it's really hot in here. And I remember this because there was one time my wife said that to me. She goes, are you hot? And I'm like, no. I look over at her and she's literally sweating. And I was like, oh my God. And I realized it was a hot flash. It's intense. So what I will warn you, I told her it wasn't hot. She was pretty mad at me. So I learned whenever after that she says, is it hot? I say, you know, it is. Let's turn on the air conditioner. Let's open a window because it's a pretty severe thing. Now, let me bring you back to this. Why I'm making an issue of this, are you treating pain with menopause? You're not. You know what you're treating with menopause? Hot flashes and probably insomnia. So guess what your goal is? And what I'm pointing out, acupuncture is not about pain only. This is to reduce the frequency and severity of hot flashes and help a person sleep. The same would be like with asthma. That's not about pain. Constipation maybe could, but the cure of constipation pain, get rid of the constipation, which could be diet. So what I'm highlighting here is look at the difference of this type of coverage. So that's why I wanted to show you all three different types. So we did Aetna, we did Cigna, and now we did United Healthcare Optum, including the Blues. I will tell you, in some areas of New York, when you have Excellus or New York SHIP, they actually cover addictions. Yes, addictions to drugs and alcohol, far beyond what you'll see with other plans. So it's always worth checking, what is the coverage? So the number one thing is verify the type of coverage. I've given you a pretty generic list, but what I will tell you is, I bet all of you, if you bill insurance, are going to pick a code from the list I gave you, and that's what I'd want you to do. And here's what it comes down to. You don't need to use a lot of codes. I bet most of you, if I went to your office, you probably treat regularly the same 10 things over and over. Because you kind of get, a person has a headache, they have joint pain, neck pain, and otherwise. If you think of it, yeah, that's pretty common. Or maybe you specialize in something. So never think you need to know 100 codes or thousands. Know what you do and what you do well, just as sure there's going to be benefits for it. So that's why I wanted to give you this list. This is a pretty exhaustive list. This is something I think is going to do you well to know the different type of payers. Well, let's take a look at one more. This is the United Healthcare protocol. And you'll notice for United Healthcare, they follow the National Institutes of Health. And it says here, it's been endorsed by them, and it can be useful, here it is, as an appropriate treatment for pain and nausea. You know what? I actually like that. I prefer someone just say it's pain and nausea, because that means I'll just code nausea or pain. I don't care as long as there's pain. But it also says something more, though. Useful as an adjunct treatment and acceptable alternative, or be included in a comprehensive management program, notice, for addictions, stroke rehabilitation, headaches, menstrual cramps, tennis elbow, fibromyalgia, myofascial pain, osteoarthritis, low back pain, carpal tunnel syndrome, and asthma. Whoa, isn't that a big difference? I was teaching seminars with Maryland right at about 1999, 2000. And I would always have people say, hey, Sam, the program was good, but you didn't cover the things that I treat because some of you were specializing in internal medicine. Well, at that time, there was no coverage for that stuff. And I always hope that those people are still practicing to see the differences of what we have now compared to what we had 20 years ago. There's a lot of change. We want to give people access. Well, here's one I want to share with you, because this is a state that I will say is probably the most pro and friendly to acupuncture of any state. And I can say that because Blue Cross Blue Shield of Massachusetts is by far the largest insurer of people in the state of Massachusetts. But take a look at the coverage. It says acupuncture benefits for 12 visits a year. Now, that's not great. I wish it was more. But notice what it says. For any reason. Medicare Advantage plans are excluded. It's going to follow just like the regular Blues. There is no requirement for a diagnosed medical. Someone could come in just to get acupuncture because I do not feel good. I want to feel better. Literally anything. Now, they give all types of things, the menstrual cramps, the tennis elbow. Notice what this sounds like. Doesn't that sound pretty much like what we saw earlier from Aetna and Cigna? But notice it goes even further. Digestive, emotional, eyes, ear, nose, and throat, gynecological, musculoskeletal. Could you imagine if these carriers started all adopting this? Well, I'll let you know. Massachusetts is where Obamacare started, which wasn't started by President Obama, by the way. It was Mitt Romney. I hope we see more people do this. It would allow you to do what you do. So when you verify benefits, find out what type of plan, what does it cover? Don't be afraid to ask. If they say pain management, you know right where to go. But if it's Blue Cross Blue Shield with Mass, you can pretty much code anything. I can tell you, I know the company Kaiser covers infertility with referral. Don't be afraid to make sure your patients reach out for their benefits. So that's the diagnosis part. I don't want you to make it that hard. Now you might say, well, do they cover this or that code? Well, that's one of the things that in this forum, it would be very hard for me to try to address all of that. What I would say is take a good look at the list. And it's one of the things I do. We offer a service. I teach these seminars, of course. We do them all across the country. But what I also do is work with you one-on-one. We call it the network. And what it is, you join, and then I become part of your practice. You email me, you call me, we can Zoom together. You can send direct messages on any issue to make sure you're getting paid. Because you know what my job is? To make sure your practice does better. I work with the American Acupuncture Council. We have a very vested interest in all of you. Quite frankly, we would have no business if it wasn't you. This is why we put together programs like this, because we want to fortify what you do. So you need to diagnose and know what is covered. Now, that's simple. What's wrong with them? Sometimes keeping it the simplest may be the best solution. But now here comes where the payment comes in. You're going to notice here I have codes we call evaluation and management, which I'm sure many of you are familiar with. Evaluation and management codes, you know what I'd like you to think of if you see these? Think of them as exam codes. That's what they are. You're examining the patient. And these codes are brand new. Now, the codes aren't new, but the descriptions are. And I want you to see how easy it is. This is the first time they've updated codes, I think, that make more sense. So the codes start off with what we call a new patient or an established patient. So let's make a simple understanding of what that is. Every patient that comes to you, what do you have to do the first time before you treat them? You have to evaluate them in some manner. Now, some evaluations could be very detailed, some could be very small, but there's going to be an exam. So that's why there's that many different codes. They all depend on the amount of exam you need to do. So it's pretty straightforward. Tell me how much time you spent, I'll tell you the proper code. But let's make sure we understand the codes, because you'll notice one says new and one says established. This is pretty straightforward. A new patient is just what it sounds like. It's a brand new, I've never seen you before patient. But it's also a patient who hasn't been in the office within 3 years. So let me give you an example. You have a patient coming to you that you saw 2 years ago. That's not a new patient. But if you saw them 4 years ago, it would be. So even though they're not new, because it was more than 3 years, it makes them new. So make it simple. A new patient is brand new, someone you've never seen before, or someone you haven't seen in 3 years. Now, let's keep this in mind. It doesn't matter that the patient had an accident or a new injury or a new complaint. What makes them new is they're brand new or 3 years. None of those other things matter. Let's say you were treating them for cash, and now they want to use insurance. That still doesn't make them new. You're going to bill according to what you do. An established patient is an exam of a patient you've already seen before. So it could be someone you're doing a re-exam after 30 days, but it could also be, I saw someone 6 months ago for headaches, now they're coming for shoulder pain. These are the codes I use. But what I will tell you is, you have to examine everyone. Therefore, I want to bill for it. These codes have the highest value. Now, you might think, ooh, how do I choose the code I use? Well, here's something cool. We all know this is the year of the tiger, correct? It is. However, you know what it really is? Well, I shouldn't say really, but what I also think it should be in your mind, the year of time. Because exam codes are now timed, and so is acupuncture. So if you can always think of document your time when you're dealing with a patient, you will resolve most issues acupuncturists have. And here's something really cool. I've been to a lot of acupuncturists. I've taught a lot of acupuncturists, but I've seen an acupuncturist since the middle 80s. Anyway, the one thing I see pretty consistent in your profession is this. The one thing that acupuncturists always tell me is, Sam, I spend more time with my patients than the average provider. And that is honestly true. I've always spent more time in an acupuncture office ever than in a medical or chiropractic office. That's pretty true. What I'm saying to you is good. Document it. That's all. Document it. Literally tell me how much time you spend, and that will tell me what type of codes and services you've billed. So I want you to think of how easy that becomes for these codes. Take a look. A 99202 says it's an office or other outpatient visit for the evaluation management of a new patient. Okay. It says what requires a medically appropriate history and exam. That's straightforward. So something simple. But here's the easiest part. When using time for code selection, 15 to 29 minutes. So it means if you spend 15 to 29 minutes, this is your code. Or if it's 99203, 30 to 44 minutes. Or 45 to 59. So now what I'm saying to you unequivocally, you may choose a code based on the amount of time. Now I want you to think for a second, this is where always in the old system, I felt acupuncturists were cheated a little bit. Because I would say generally, I think Marilyn would agree with me. Do most acupuncturists see someone as the primary provider, meaning they've never been anyplace else first? Probably not, unfortunately. I hope we change that. But how many times have you had a patient that goes, well, I've been having this back pain for about 6 months. I first went to my medical doctor. He had me go to physical therapy. Then I tried a chiropractor, and that didn't work very well. So now I'm coming to you. So I want you to think of that for a minute. This person's coming to you with back pain. Not overly complicated. They're not going to die from it, but it's hurting. So you got to take the history of all the symptoms. But what else do you have to do? Well, when you went to the medical doctor, what did she say? How about the physical therapist? How about the all of a sudden now, maybe you spend 30 minutes taking just the history. You spend maybe another 10 or 15 minutes doing your exam. I would say the majority of acupuncture patients are going to be within a 203 and a 204 because of the time you spend. So I want to make this simple. When you examine someone, I need you to tell me how much time you spent. How easy is that? If you told me you spent 45 minutes, it's this code. If you spent 30 minutes, it's the other code. Not very complicated, is it? And in fact, notice something a little bit more about this detail. It says when using time for code selection, 30 to 44 minutes of total time is spent on the date of the encounter. So wait a minute. Most of the time, and I'm sure most of you are familiar, acupuncture codes indicate face-to-face. So for acupuncture, you do have to be in the room with the patient. But for an exam, not necessarily. So I want any of you to think, how many of you have your patient fill out forms before you see them? They fill out a detailed history form that you read for 10 minutes or so before you go in the room with the patient. Maybe even more. How many of you use an electronic health record system that the patient fills out a lot of details? What this is telling you, so let's say I have a patient coming at 10 o'clock in the morning, but I get to the office at 8, and the first 15 minutes, I'm reading their file to be familiar with all their symptoms. So when I get in the room, I ask questions. Here's what I'm pointing out. That time counts. So it's the time of the day that you spend. I also want you to go a step further. Obviously, the time you're with the patient too. But I want you to think for a moment, when you finish with a patient, are you always finished? And what I mean by that, yes, you are. But how many of us have to spend maybe another 5 or 10 minutes finishing the chart notes? On an exam, that time counts. So what I need you to do is always tell me how much time you spent on the exam, whether with the patient or evaluating information. It just has to all be on the same day. If you do it the day before, it doesn't count, or the day after, but the same day of an exam, it does. And the reason they did this is to try to make it easier to start to choose codes, because medical doctors often could choose a very high code for 10 minutes. And I want you to see why that's still the case. It says here in a 205 for the evaluation and management of a new patient, which requires a medically appropriate history and exam and a high level of medical decision making. So I want you to think of it. Have you been to a medical doctor? I went to one for a colonoscopy not long ago. I turned 61, had to have another one done. And when I saw her, I was with her all of about 15, maybe close to 20 minutes, but not more than 20. I had not seen her before. She billed a 99205, and I saw her less than 20 minutes. and she charged like $500. Now my insurance paid the whole thing, so what do I care, I guess? But here's my point. How could she do that for 15 minutes? Well, if you think of it, what's a colonoscopy for? Cancer. How severe is cancer? So severity-wise, it's a high level of medical decision-making. So that could work for you too. So I'll point out, these codes have values that sometimes maybe somebody has something very severe, you don't spend a lot of time. You could go the other way as well, and we'll talk about that. But for the most part, I think on the first visit, acupuncturists spend a lot more time. And I'm not trying to talk you into using 04s and 05s, and I'd be careful. If you spend an hour with every single patient, no matter what, that's a style issue. You should spend more time with someone with a complicated problem than a less complicated. So if someone with a hangnail, you're spending an hour, I'm not wanting to go this code. You get my point here? So let's be careful there. But it isn't unreasonable when you think of the types of things people see you for. Now, that's a new patient. An established patient means a patient you've examined before or seen before. And it's these codes. Now, the one difference here, well, wait, there's a 99211. There's no 01 at the top. This code, though, in my opinion, you might as well eliminate from your vocabulary. And the reason for that is, notice it says, may not require the presence of a physician or other qualified healthcare professional. Means you didn't do it. There's no exam that can be billed in your office unless you've done it. Therefore, this would never apply. This would be like for a medical doctor that has a staff person check a blood pressure. So that's not going to be used for us. And it's going to be the same thing, 212 to 215. It's all timed. So I'm going to make this simple. When a patient comes in, we verify how they want to pay for their care. If they're going to use insurance, great. We're going to verify the benefits. If it has acupuncture, fantastic. Come on in. I'm going to examine you. And based on the level of exam, probably mostly time, I'm going to choose the appropriate code. And I want you to understand how you choose the code. Now, I said two different ways. It said total time, which we understand, but the other one says level of medical decision making. I'm going to give you a quick primer on that. I don't want to overcomplicate it. It's just severity. But I want you to think of mostly time, because that's probably going to be the driving factor for most of you. Because think of it, how many patients come with all these chronic issues? But I want to make an importance of it's time spent by the provider on the day of the visit, not just the how are you feeling. Anything you do before or after directly related, as long as, again, the same day. So I'm going to make sure everyone sees this clearly. I want you to include everything. The things you do before you see the patients, the things you're doing as you see them, doing the exam itself. But here's one, counseling. How many of you, as part of the visit, counsel your patient about you need to drink more water, you need to change your diet? Those things would count towards that as well. Obviously, you don't order medications, but possibly tests. Maybe referring out will count. Documenting the information, as I mentioned. Interpreting results of tests that may have gotten there. We don't commonly see that, but it's possible. Coordinating care with other providers. And discussing ongoing treatment and lifestyle. So I want you to think that all counts. Now, what I want to make sure, though, it's all on the same day. If you like to the next visit do it, that's fine. Like the next visit, you want to talk to them about lifestyle changes, that's fine. It just doesn't count towards the time of the exam. You've unbundled it. So I'm going to say, try to get everything in. I would say, I doubt there's an acupuncturist that does a new patient exam for less than a half an hour. And I say that that's my own bias and experience, but I would say that's probably pretty true because of the things you're dealing with. You're not the first person they're seeing. They've been a lot of places. But what doesn't count towards the exam, keep this in mind, is what you do for treatment. When the exam is over, time starts for acupuncture. Those are separate. So you got to make sure to separate exam time from treatment time. Beyond that, really straightforward. So think of a patient comes in, how do I figure out what's wrong with them? I examine them. Tell me how much time you did taking their history, doing the exam, counseling them to make the diagnosis. I'll tell you the appropriate code. Once I've made the diagnosis and I start treating, then I do that accordingly. But here's something to note about exams, and this is where most acupuncturists, and I literally answered that question before I came on with you. I normally don't answer questions on the weekend, but because my computer came on, all my emails popped in, and this question actually was one of them. It said, Sam, I did not get paid for an exam, and I've been billing, and this particular company was Blue Cross. She said, I didn't get paid for the exam. Well, here's why. I asked her a simple question. Did you bill with a 25 modifier? She responded back and said, what's the 25 modifier? That was the answer. Whenever you bill an exam with treatment, it requires modifier 25. So let me blow this up. And this is how the bill would look. Notice the E&M code 203 has a 25 because there is acupuncture. Now, why do we do that? Well, we do that because the acupuncture code, as does all treatment codes, whether you're a medical doctor, chiropractor, physical therapist, all of your treatment includes a small evaluation. So I'll give an example. In fact, let me just make myself big on the screen so we can think about it. If I'm your patient and I come to your office the very first time, you're going to say, hi, Sam, how are you? Nice to meet you, or so on. Tell me a little bit what's going on. Why are you here today? And you're going to go through my whole history. What happened, what's wrong now, family history, past history, all of that. You're then going to examine me. After the exam, you're going to counsel me, then do treatment. Okay, good. That's a full exam. But let's talk about when I come back on my second visit. I came on Monday. Now I'm coming back Wednesday. I come back on Wednesday. Are you just going to say, hi, Sam, lay on the table and start putting needles in me? Or are you going to say, hey, Sam, how are you feeling today? Is that a little better? When you left last time, you were in some pain at first, but it was less. Is that better now? In other words, what are you going to do? You're going to review my chief complaints. So we call that pre-service. You know how you look at someone's file before they come back? You read it for a minute or two. That's considered part of the visit, reviewing their complaints, talking with them how they're dealing, preparing the room for care. But it's also, once you're in there, discussion about the services last time, doing evaluation things. So here's what I want to point out. Every treatment has a small exam. Therefore, when you bill insurance, you have to add a special modifier to make sure the insurance company knows that the exam you have provided is separate, above and beyond, and distinct from the exam associated with treatment. And that's exactly what this example shows. This 25 tells the insurance that this E&M was a significant, separately identifiable service above and beyond the usual pre-service, post-service work. Period, end of story. So think of how simple that is. Oh, that's what I need to do, is put a 25. Now, some of you may say, hey, Sam, I'm billing United or billing another company. Some companies won't pay for exams when you are in network. It's the contract you signed. If it has out-of-network benefits, it does have to pay it. So check your contract. The majority of time, we simply haven't billed it right, and or they don't believe you did enough of an exam and maybe want to see your notes. So let's talk about it. When you bill an exam, that exam is obviously the first visit. So I'm going to bill 99203 with a 25. But on the very next visit, I'm not going to bill an exam because I'm doing the one inclusive. You're going to do an exam about every 30 days. About every 30 days. If it's sooner than 30 days, it's probably not going to get paid unless there is a new injury, a new complaint, or something of that nature. So do keep that in mind. Not one every visit. It's one of the problems acupuncturists run into, because I know what you're thinking. Sam, I do an exam every visit. And in a way you do. But that exam is part of the day-to-day visit. It's not until you do a full re-exam. So be very careful. When you do a re-exam, it should be more than what you do day to day. If it's not, then it's not a re-exam. So make sure a re-exam really goes back over everything. On a day-to-day visit, you don't do a full exam, but you certainly are doing a cursory over the areas that are affected. So keep in mind, cannot do one every day. And let me show you directly from the CPT manual. And it says here, you can bill an E&M, but it may be reported separately using modifier 25 if the patient's condition requires a significant, separately identifiable E&M service above and beyond the usual pre-service and post-service work. So you might say, but every day I do that. Well, that means that's part of your normal every day. I have an acupuncturist. She does literally do a full evaluation of her patient every time they come in. And I say, God bless you for it. But no one's paying you for a separate exam except for the first one. Because why would I pay you for an exam when it's the same thing you do day to day? So I always will say, make sure your exam is distinctly separate and one above and beyond. It is inappropriate to bill an exam on a day-to-day visit. It is not. It will always lead to trouble. And it's one of the things we deal with the American Acupuncture Council. Many of you are insured with us. And if you ever have a problem with an insurance, guess who protects you? The American Acupuncture Council. So if you're audited because something's gone wrong, what they're going to do is bring me in and other attorneys to help fight back on it. But here's what I want. Don't make me fight back on something I have no fight. If you're billing an exam every visit, it's very doubtful that I could ever fully defend that. Maybe every 30 days, but each time, unless the person had a new injury. So be very conscientious of that, because yes, we're going to defend you, but we have to have something to be defensible. So no exams every visit. And I know some of you go, but they pay it. Yeah, they'll pay it for a while. When they eventually catch it, they're going to ask for all the money back, and we don't want to go there. Okay, so inappropriate day to day. In fact, take a look here. This is from the company called Core Care. And I want you to see here what it says. Benefits are provided for an initial evaluation, which is usually performed at the beginning of treatment. The benefits are provided for a reevaluation of acupuncture at 30-day intervals. And again, it talks about the 25 modifier. So I want to be clear, this is not my opinion. This is the rule. Okay? So I don't care what your friends told me, and this is where you want to be careful. Don't do Dr. Google when it comes to this stuff. Because anyone who could put information out, it will be there. And Google doesn't tell you it's right. They'll just tell you it's information. So be very careful also of blogs. That's why you always want to have an expert, someone that deals with this. Is why do you think the VA, when the VA has a problem about documentation, guess who they come to? Me, the state boards, me. And I'm not saying that as a level of brag. I'm just saying that's what my job is. And what I'm saying is, if the VA is hiring me, if the state board and the insurance companies are, don't you think you might want to have that acupuncturist on that person on your staff? And I'll talk to you about how you can do that later. Not very expensive. So we examine someone. Easy. What else are we going to do? Acupuncture. I'll tell you right now, when I go to an acupuncturist, I want acupuncture. You know why? Because that's what you do differently. If I want a PT, physical therapy, I might as well go to a physical therapist. And I'm not saying you shouldn't do physical therapy, but I want needling. Do you know the funny thing, most people though? Most of us that are not acupuncturists, I can remember the very first time I went to an acupuncturist, I was a little disappointed, at least in this part of it. I was very happy with the results, but I thought she should have used more needles. I didn't know better, so I thought, well, if you're going to put 5, why not 20? Let's really go. And I think that's the thing most patients are surprised by. They always think everyone, like if you watch the stereotypical acupuncture on TV or in the movies, they got a person, they look like a pincushion. And no one does that. I mean, you're like, no, that's not how acupuncture works. And so I think that part, but the part is that it's needling that makes the difference. And so I'm going to emphasize to you, what should you mostly do with every patient? Put needles in them. So let's talk about that service. We're given 4 codes. They're not very complicated. They're actually easy. They're better than what we used to have. We have 2 codes for manual acupuncture and 2 for electro, and they work in this way. It says acupuncture, 1 or more needles. So in order for it to be acupuncture, shocking, you have to put in a needle. Okay, that makes sense. If I don't put a needle, I don't think it's acupuncture. So they're telling us you got to put a needle, at least 1, it could be more. And then it says without electric stim, but it says 15 minutes of personal one-on-one contact. So here it comes down to, you have to put a needle or needles in someone and spend 15 minutes. Now, it's not 15 minutes putting the needles in. I've never been to an acupuncture, so they went, okay, hold on. There goes 1. They're pretty much boom, 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 boom. But it's not that fast, meaning when you go in the room to greet the patient, to do and you say, hi, Mrs. Jones, how are you feeling today? That time begins. So I want everyone to understand your time for acupuncture begins as soon as you enter the room. And it continues until you leave the room. So I want you documenting an exam time, yes, but also acupuncture, because you'll see it's needles and time. Now, how does the additional sets work? Oh, let's see. Time and needles. So it comes down to, if you spend 15 minutes and insert needles, that's the initial set. If you spend another 15 minutes and insert needles, that's an additional, and that can go on and on. I will say to everyone, the typical allowed per visit is 3 sets, however. There are some insurances that may pay more, but most are allowed only 3. But nonetheless, just give me time and needle insertion. So that's manual. Electroacupuncture, exactly the same. You know what the difference is? There's electricity attached to the needles. Now, do you have to attach electricity the whole time? No. But if there's electricity attached, that's what it comes down to. So we have an initial and a follow-up. Now, why is this better than the old codes? These codes more directly reflect what you do. Like, I could look at your bill and know exactly what you've done if you code and examine 3 sets of acupuncture. I know that you spent 45 minutes, did 3 insertions, and did an exam for 30 minutes. In the old code system, it was one code. I don't care what you did. And I wouldn't think that would be very fair if you think of it to acupuncturists. Do you get paid more, or let's make it even simpler. If you got a 30-minute massage compared to a 1-hour massage, would we all expect to pay more for the 1-hour massage? Well, yeah, because it's 1 hour. Well, it's the same way with acupuncture. If I do 2 sets, I get paid more than 1. If I do 3, more than 2. So that's how these codes break down. So it's pretty simple. Tell me the time, and did you do insertions? Now, what you'll notice, though, it says 15 minutes, and this is where a lot of people get confused. The 15 minutes actually goes under what we call the 8-minute rule. So it says here, the 15-minute increment of time is defined as personal one-on-one contact. That means you're in the room with the patient. But you actually don't have to spend 15. You'll see here it follows something called the 8-minute rule. I'll make the mouse go around it. Notice one set could be as little as 8 minutes. So could you do everything within 8 minutes and still build 1 set of acupuncture? You honestly could. Now, I doubt that's realistic. I've never been to an acupuncturist, never heard of one that could do that. Maybe if you've been to a modern acupuncture facility, maybe they can come in there and put them in less than 8 and take them out and let you go, but I doubt it. I bet you spend much more than that. But minimum time for 1 unit or 1 set is 8. But don't be confused. 8 minutes is the minimum for each set. So a second set is 8, but it's 8 plus the first set of 15. So that's why you'll notice 2 units is 23, not 8 plus 8. It's why 3 units is 38, 30 plus 8. So you need to make sure the time, but notice it's not 45 minutes. So here's what I need you to do. If you're going to use acupuncture in billing, just make sure you have down, here's the service I did. It was manual acupuncture. I did 3 insertions and it took me 45 minutes. You've got it. Pretty straightforward. So again, it goes back to, as I said, the year of the clock, the year of time. Tell me how much time. I think this should be something very easy for all of you because you do spend a lot of time with your patients. Do you know partly that's why patients really love their acupuncturist? Do you know to a patient that comes to see an acupuncturist, you're what doctors used to be in the 40s and 50s, where they would literally sit and have a conversation, hear you. When you go to a medical doctor, everything's so fast now. You see the doctor for 5 minutes, maybe you don't even see the doctor, you see the nurse practitioner. And I'm not trying to be a put down for that, but you know what you're going to be to these people? A savior. Because do you know a lot of times people just need to talk to someone? Because there's a lot of emotional parts of that. Oh, wait a minute. What profession brings emotion into the medicine? Oh, this is why I think acupuncture does honestly work so well. So don't take that away. You don't have to be needle and run. Get in there and deal with your patients. If you're spending time, you can document it, and we're good. Now, do remember, let me give an example. What if I insert needles in someone? It takes me 10 minutes, and I leave them resting on the needles for 30 minutes. I then come back in the room, I remove the needles and see them out. With that type of time and insertion, I can bill only 1 unit. Why? I did 1 insertion. Even though the patient was there longer, it didn't matter. There was no more face-to-face time, no more insertion, no other insertions. So notice here it says, do I need to reinsert needles? Yeah, you have to reinsert. Let's be careful. The term reinsertion is poorly written. It should say additional insertion. because obviously you can't take a needle out and put it back in. That would never be clean needle techniques. So it's an additional needle. And you can have some sets that are manual or electrical. So by example, if you have a patient that comes in and their first set is manual, you would bill 97810 because that's the first set. If the second set were electro, you would bill 97814 because notice here, you can never code a 10 with a 13. There's only one initial set. So let's go back and make this simple again. Patient comes in, we verify their plan. We evaluate them, we use an appropriate code. Assuming we're going to bill with treatment, we put a 25 modifier. We then now just decide on what acupuncture we've done, and then we code accordingly. I choose to do 3 sets with a person. I document set 1, set 2, set 3, which points for each set, and then the time, and I send a claim out. Not that complicated. You can get paid well for that. Don't focus for much more than that. Keep it very simple. Now, to make sure you can see some references for this time, I gave it to you, but I wanted you to see it from Regents Blue Cross Blue Shield. The 8-minute rule, notice 8 to 22, 23 to 37, so you can see it there. In addition, this is from Excelis. It's another payer. I want you to have references for this. Notice it talks about the codes and time. This doesn't talk about the 8-minute rule, but why it included it. Notice what it talks about. Everything you do, from the moment the person you walk in the room and say, "Hi, Mrs. Allen, how are you doing?" It starts. But it includes things like hand washing, doing the notes, everything that's related to your service. So I'm going to make a simple statement. Document time, record it, get used to it. I don't care if you tell me you spent 1 hour or if you said I went from 5:05 to 6:05. Either of those are acceptable, but I do need the time there. And remember, when it's the acupuncture part, make sure it's separate and distinct. So I'm going to, again, make this emphasis. This is not hard. Now, here's why I make an emphasis towards this. This was an office that got denied. And you'll notice they billed out 97810. Notice they billed $105. Now, I was contemplating showing you EOBs, but I don't want to entice you too much. I have offices that regularly get paid $200 to $300 a visit. I'm not kidding. Now, I think that's a bit expensive because it's hard for that to work with a cash office, but what the heck. Anyway, here's one that they billed acupuncture. This is one that was sent directly through to the American Acupuncture Council. And this is what we do. We help you with audits. And it says the information submitted does not contain sufficient detail to support all related charges billed. And it says the submitted medical records do not support that acupuncture, 1 or more needles without stim. The documentation submitted does not indicate the time was personal one-on-one. Can you imagine how easy would have that be, to be paid if they simply put, I spent 40 minutes, or now it's only 1 unit. But imagine this office, because their documentation didn't have the time, lost out on $105. Is that real hard? No, it's not. Follow just what I showed you. Here's another example. Here's an example where the first set, now I take a good look at this because they're all United Healthcare because I deal with a lot of these. Because guess why I get a lot of United Healthcare? Remember I said I'm on their reimbursement committee? So I get to see all of them. But here was an office from last year. They appealed it and they got it paid. So you're going to go, wait a minute, Sam. This office is charging $225 for a set of needles. Yeah, I agree. That's too high. But you know what? I also don't agree that I would want to pay $5 million for a house that's 1,000 square feet in California. So keep that in mind. Like I'll have Marilyn laughing. You'll see she's going to laugh in a moment. She's been to my house. I have a nice house. It's fine. It's not very big. It's just my wife and I. You know, so we have 3 bedrooms. You know, it's 2-story, 2.5 bath. Do you know my house costs well over $1 million now? If you came to my house, I will guarantee you would look at my house and go, that's not $1 million house. But it is in California because also I live 2 miles from the beach. So maybe that helps. But what I'm pointing out, depending on your area, could this be the price? I would love it. There's areas all over that could pay this well, but let's be careful. That's a whole nother topic we'd have to deal with. But what I want to show you is they reconsidered it because I helped them. And they reconsidered and they said, yeah, you know what? We are going to pay for the first set. But on the same visit, we're going to reject the second set. But here's what happened. This office just indicated they spent a total amount of time. They never indicated one set to the other. So as a consequence, we couldn't really dictate that second set, but at least we got the first one paid. But wait a minute. Are you telling me here, Sam, that this office charges $225 for the first set and $300 for the second? No, that was for two sets. They charge $150. But think about that. You're going, wait a minute. For one visit, this office is billing $525. That may seem ultimately ridiculous, and in my opinion, it kind of is. However, this is an office in Florida. They're in the Miami area, so a little pricey. Do you know they honestly get paid of that amount of the bill? About $440 of it. The patient has about a $60 copay. Do you think I'd like to have a few patients like that? Probably. Here's the problem with this, so let me highlight this, because this is enticing. You're thinking, oh my God, of course I want to bill insurance. But you've got to come up with one answer to give me. How can I charge this to this patient for 3 sets and a cash patient pays only $100? The answer to that is you cannot. Well, at least not legally. So I want you to think of, when you're doing insurance, don't think of insurance as making more money, but getting more patients and making more money. Because you should not have any substantial difference. The difference of your cash price to your insurance price should be no more than 5 to 15%. Now, that's if you're in California, I'll exclude that. California has some unique laws for that. But every place else, 5 to 15%. So I have no problem with this office billing that. But I asked them, do you have cash patients? You know what their answer is? No, we don't. I'm like, okay. But notice, first set was considered, and here's the whole thing. It comes down simply to time. Time. So now, what else can you do? Now, notice what I've done here is giving you a page of all the codes that you're going to bill as an acupuncturist. Well, everything except injections. You'll notice in the bottom right section, I have acupuncture codes and dry needling. I also have laser codes here, and I have all the physical medicine codes. Now, how many of you do simple treatment with patients that are physical medicine? I would say most of you. It's typically part of your scope of practice. So what do most of you do? Probably most of you, what you might do is, how many of you do like infrared heat, a heat lamp or a TDP lamp? That's going to be coded 97026. Simple, use that code. Put a heat lamp on, you bill that additionally. The one thing I want you to see about this code, though, it's a modality that doesn't have time. So this one, when you put it on a patient, you can bill for it. You don't get paid for doing it more. Okay, you get paid just because you did it. Now, there are other codes that do have time, and that's going to be these down here. You'll notice these codes all have time. Now, these aren't very typical. Now that people aren't doing ultrasound, but to make it simple, if you were to do one of these services, you could bill additional units based on how much time you spend, and it too follows the 8-minute rule. Notice I put laser. There are some payers paying laser, not a lot. There's therapeutic procedures, and I bet here some of you are doing these. Now, therapeutic procedures, what is that? Exercise. Okay. Maybe a therapeutic activity some of you might do, but I know 2 things you do, massage and manual therapy. That's pretty common for an acupuncturist. Absolutely, you can do them so long as you're within your scope of practice, every place except New York. But nonetheless, these are timed. So if I do 1 unit, then 15. If I do 2, 30 minutes and so on, I just bill in units. So the key is here, tell me what you did for a patient and I'll give you the codes for it. This is a pretty comprehensive list. In fact, it's comprehensive enough to tell you it's all physical medicine codes. Now, again, I don't think you're going to do everything on the list, but you might. What I'm going to suggest is bill the services you do. You might say, I don't want to bill for that one. It bills to you. Okay, leave it off, but I want the choice to be yours. Unless you are having a free clinic, people should pay for the services I provide. So I want to make sure to bill appropriately. So the appropriateness is supervised modalities are 1 unit. The other codes that are constant attendance or therapeutic procedures, you can bill multiple units because they're time. Not very complicated. In other words, your bill just reflects what you do. We use codes, and that's where people get confused because codes just tell me something about it. Like in fact, I wanted to share with all of you, I was going to do it at the end. I'm a track coach. I was a professional track athlete, and I'm one of the, I'll just say probably one of the number one track coaches in the state of California. Do you know the best sprinter in the state of California, at least one of the best, is Chinese? He's a Chinese exchange student. His name is Scott Deng. In fact, I saved it here because I'm very proud of him. This is him yesterday winning the Orange County Championship. So that's him winning. No one was near him. And I'm really tickled because turns out I didn't realize his mother's an acupuncturist. And when she found out that I was the coach and yet I do acupuncture, she's like, oh my God, I can't believe it. And I'm just pointing this out to just say your medicine and culture is part of the fabric. And it's the beauty of our country is that all of these things can kind of meld together. And the types of things you do are being accepted and being covered. But the one thing you might look here is like, well, wait, Sam, I don't see any code for cupping and moxibustion. So let me jump ahead here. I'm going to come back. This is the rock. This is me. We both got cupped. And you may think, well, I don't see the code for cupping, Sam. Where is it? There is no code for cupping. So that big list I gave you, there's no code. So what do you use instead? You're going to use what is called an unlisted code. Now, to make that easy, this is what you do. Notice I build acupuncture, and then I put 97139, but I put cupping up here. That identifies this as cupping. Do you know who pays for this? The VA. And they pay quite well for it, about $40. I'm not going to say every insurance will cover cupping, but I'm certainly going to give them an opportunity to pay me. If the insurance doesn't cover cupping, what should you do? Inform your patients it's not covered and charge them a fee for it, or give it away for free. It's become exceptionally popular. That's why I use these pictures, because if this guy's doing it, trust me, a lot of people are wanting to do it. Here's a couple of other things, though. I mentioned earlier about the limits of acupuncture, and this is just highlighting, this is from United Healthcare, that the maximum amount per visit is 1 initial set and 2 additional. So I want to make sure if you run into that, you will with some carriers, that it is going to be 3. I have no problem with that. Something else that's a little bit unique, when you bill a physical medicine code or a physical therapy code, and this is going to be to companies like United Healthcare and others, you have to use this modifier called GP. So if you're billing United Healthcare, the VA, or Anthem Blue Cross Blue Shield, which is pretty much everywhere as of last year. So Michigan, California, Indiana, Kentucky, and most every state, you have to put the modifier GP on it. So I have a lot of people going, Sam, I billed for infrared heat and it says it's not payable because I didn't have the right modifier. It's GP. I know a lot of you think, oh, I'm supposed to put the 59. No. The modifier 59 honestly is never used for acupuncture. It's GP when it comes to these particular plans. If I have anyone from California, though, quick note, it's Blue Cross of California, not Blue Shield. I know, kind of weird. But again, think of it. If you didn't take this course and you're billing United or VA, you wouldn't get paid for the therapy code. And you would think they don't pay for it. Didn't use the right modifier. So I'm going to circle back about billing. Billing is not hard. It's all about what we're formatting. So here we have a sample claim. And I want everyone to see, I gave you a free sample claim. This is an initial visit. Notice not everything is filled out, because you don't need to fill out everything. Patient's information at the top, then what's wrong with them, their diagnosis code, and the codes of treatment. Now you might wonder, why do I put the letter A here for pointer? All I'm doing is this is what I'm treating. I'm pointing to A. If you have 2 diagnoses, it would be AB. Notice you just put the totals in. But I want everyone to see something unique about this visit. Do you notice this patient had 1 initial set? But notice on this line it says 2. So if I'm billing 3 sets of acupuncture, this is the initial, this is 2 additional. Notice the price is $90, and it's because it's $45 each. So if I were billing 3 additional sets, this would be $135. So remember to always multiply. But what I'd like you to see is just a nice, easy sample bill of an initial patient with the proper modifiers. And here's one with a follow-up. It's actually the same patient. But notice the difference. Some visits you may do more, some you'll do less. Notice there's no exam billed because we don't bill on every visit. Notice also, though, that on this visit, we only did 2 sets. And what I want to point out to everyone is you can do different treatment each time. It's not mandated you have to do exactly the same thing. And I know when I've gone, often I get a lot of consistent care, but there's always, oh, today I see something a little different. Maybe it's an extra set. Maybe it's some extra myofascial work. They're going to provide that for me. Don't make this hard. You could actually fill out this form by hand. Now, I want to go back a page here. This was just about time services, and I wanted you to see a reference for it. This comes directly from AMA, just to make sure you have a reference, and it talks about how to document. But I want to do one more thing before we come to a conclusion, and we can ask some questions. You may watch this and go, Sam, thank you. It was so good. And I always appreciate compliments like that, so thank you very much. However, you might say, you know what? I don't think I want to bill insurance. But I would suggest, good. I don't say you have to, but how about give a patient an ability? So what if I went to you and you don't take my insurance, but I like you, I want to go to you. You give me a receipt and I bill my insurance. And that's what's on this page. It's called a super bill. Now, we have a system, we call it the AccuCode, where it's a coding manual, but it's also a form manual, and this form is there. This is a statement you give your patient. You have your patient information at the top. You circle the diagnosis. You can see I put about everything in here. If the diagnosis is not here, just write it up in this section. And then we have on the left side the codes. Notice all the new E&M codes, the therapy codes, and at the bottom is the total. The patient then takes this, they've already paid us, they submit to their insurance, and they get paid. Now, I will tell you, I have a bias towards this. I have learned that people are used to us billing their insurance. And so if I went to you and I needed to go to you 3 times a week, and I'm paying $125, and I then have to wait maybe 45 days or more to get paid because I don't know where to send it. Because think of it, how many people know where to send an insurance claim? So here's what I would do. I would have a patient pay me cash. I get it. What I would suggest to do is you bill for them. Tell them, I'm going to give you a simple receipt. I'll bill your insurance myself. Because if I bill the insurance, if I do it electronically, I can get a payment to a patient maybe in 2 weeks or sooner. So even though I'm paying you money, if I get it paid back in 2 weeks, I can afford it. Always go back to what is the barrier of my care. Almost always, money is a big part of that. I want to do as much as I can to try to get a person to afford care by having them help use their insurance. What if you have an insurance that's horrible? It only pays $25 a visit. Okay, good. If my visit is $100, the patient pays me $75, and I'll bill their insurance to get the $25. I always want to make sure that I'm getting paid, but I want to make sure the patient has access. I will tell you, I make a nice living, as probably many of you do, but I want you to think for a moment. When you go to the doctor, what do you expect? And particularly, even though it's kind of funny, our economy is actually good, regardless of gas prices. Everyone's got jobs. We can hardly get people to work. So obviously the economy is good, but the perception is not. Whenever the perception is bad, what do? We get tighter. Do you think people are going to go to as much to a doctor paying cash? They are not. So I'm always going to suggest to have a practice that is diversified. I want patients who pay me straight cash. Yes. I want some on prepaid plans. I've got some that are hardships and discounts and other things. But I'm taking insurance, not everything, but a lot of things. So that way, as everything goes up and down, it's like putting all your eggs in one basket. Same idea. With that, I'm going to say I have concluded this part, and this is where we're going to have some difficulty. I'll try to go through some of these questions here. It's asking here, when can we find the sources of codes that are reimbursed by a specific insurance company? I will tell you, I just gave them to you. That's my point. And if it's one you think, well, I've got a different company, well, I can't give everything to the locals, but this is why we have a service called the network. So what I'm going to do is I'm going to put in our website. In fact, let me bring it up here. Let me share this for just a second. What I would like all of you to do is go to our website. You'll see here, this is not the council. This is the network, AAC Info Network. And I want you to notice the one thing we have here is a news section. If you click on news, you don't have to be a member for this. Building a financially successful acupuncture practice, building and coding for patient communication, getting paid by Medicare, building and coding for financial agreements. All of these are here. What we're trying to do is to give you as much information. In fact, this one actually comes up with some changes that you can view a video that I did for it. I'm not going to click on it now for you to get there. What I'm going to suggest is have a resource. Well, one of the resources, and let me show you here, is called our AcuCode. When I go to our AcuCode, when you're a subscriber, I can go into this area called the document library. And when I do this, I got to give it a second to upload here. But as I do this, what we do is have a section of documents from a 1500 claim form, COVID forms, correspondence letters. But the one thing we have, insurance coverage policies, Aetna, Blue Cross Blue Shield, Cigna, Evacore. We have more than that. I got to be able to move up. I'm stuck here. Got to get my mouse to work. All right. Cigna included, HealthNet, Health Partners, United Healthcare. What we try to do is to make sure you always have a resource. We're that part of it. So I want to make sure you understand that. What I'd like for all of you to do as well, if you could, take a moment, go in here, friend us on Facebook. Just go to our site. Anything that we can do to help, we're always here to hopefully be as helpful as anyone could ever be for you. As you well know, of course, Marilyn Allen is a heck of a resource. But we are, Marilyn and I, together, so take a look at the Council for Insurance. Remember, we have audit defense, part of your coverage. And here's something interesting. How many of you buy separate liability for your premises? If you do, the American Acupuncture Council includes that in your malpractice. That'll save you a chunk of money. And those are ones I showed. Here's all of our reference information, our website, and our phone numbers. With that, let's go ahead and let me bring up these chat ones here. I lost it for just a second. There we go. Oh, someone typed it in for me. Thank you very much for someone who did that. And then someone's asking, how does an HSA work? An HSA, the health savings account, they literally have a debit card. And that debit card is used in your office. It's almost always going to be for things like health related. You know, it can't be for supplements, but we'll cover it. It just pays directly. Some of the plans, the patient pays you and they submit a bill. Someone's asking 3 insertions. That mean I need to insert the needles, then reinsert 3 times? To bill 3 units, it means you have to spend 15 minutes of time and insert needles. Then, sometime later, whether you remove those and reposition, you spend another 15 minutes and insert. It's not about how much time you leave the needles in. Someone's asking, can I code 97813 with 11 and 14? Absolutely. As that page showed you, yes, you absolutely can. And it says, someone's asking, can the Medicare claim form be mailed to Medicare from the computer network? Medicare is not going to accept a claim from you, not regular Medicare Part B. Medicare Part C will. And they don't charge you for sending a claim. You can just send a claim directly with no charge to them. If you use a billing service or you use a clearinghouse, there may be some charges for that, absolutely. And it says, why does United Healthcare only allow 201 and 202? Well, I'd have to see that because I'd have to see your claim. There is no 201 anymore, by the way. So your information there is a little bit off, but nonetheless, it depends on the level. Remember, this just changed in 2021. And then someone's asking here, if an acupuncturist is in Blue Cross Blue Shield or United Healthcare network provider, Minnesota, does the acupuncturist have to accept Medicaid? No, you do not. But you can join Medicaid, and once you do, you have to accept them. So you have to make sure, what does your contract say? And this is part of the thing, particularly for Minnesota. This is where I'm going to recommend, this is why we do the network service. In fact, let me bring that up for just a moment. I didn't show that. If you're interested in the service we do, it's called the network. For $250 a year, less than the cost of a seminar, I become part of your staff, which means you can call me, email me, or fax me, or direct message, or Zoom me with any question you have on an unlimited basis. If you're in our Platinum, I actually audit things in your office, and it includes 2 seminars. You have to take continuing education. So I'm going to suggest for most of you with questions like that, that's the best place to go. All right, let me do a few more in chat. Now, Doc, if there's ones that you particularly saw, I'm just trying to go through them here that they come up. Here's a person asking, the time limit for a reevaluation should not overlap with acupuncture. That is exactly correct. Time for acupuncture is separate from exams. Time from therapies is separate from acupuncture exams. Everything that has its own time. And let me go here. How much does each company pay for 97810 and 97814? That depends on the company, depends on the plan. Some people with Blue Shield or Blue Cross Blue Shield could have low paying plans, some are higher. There's variations depending on what you buy. Kind of like if you buy car insurance, you can buy the various lowest level or higher levels, kind of the same. But I'd say on average, most are going to pay at least probably 40 to 50 a set. Some could pay several hundred. So you can see there's going to be a big variation. Let me see if I can get someone here, another one here that's something. Oh, here's one with a code. It says, do you have a better chance of getting paid with more specific codes? That's a good question. Of course you do. The example she gives is there's a code for pain in the right shoulder or pain in the left shoulder, but there's also a code that says pain in the unspecified shoulder. I want you to think of that for a second. What is the unspecified shoulder? Are you telling me you don't know if it's the right or left? Yes, you should tell me, is it right or left? The more specific you can be, the better chance for reimbursement. So Marilyn, I don't want to just be a talking head here. I wanted you to get a chance to jump in.
Sam, I learn something every time I listen to you. So I learned quite a bit today. So let's let them get their questions answered.
Okay, great. Well, I do have a person I see. Someone put the link in the chat to download. So I see it. It's under Dr. Li Jin and Dr. Wida, everyone, and it's the ethical acupuncture. The exact PowerPoint that I went through, at least a PDF of it, is yours. And reason I did one in so much detail is because I wanted you to have all those codes. Okay. Now, someone's saying no one uses M54.9. That's not true, but I would say the more common is M5450. Oh, by the way, here's an interesting take. If you're billing a Medicare Part C policy or any Medicare, you may only use M5451 and M5459. Medicare does not accept M5450. That's kind of a weird quirk, but it's one of the Medicare rules. So now you've heard it. So make sure. I've had a lot of offices going, Sam, I'm not getting paid. The reason I point this out, actually, Medicare will accept this code too. So you're saying no one uses it. I'd say it's not common, but nonetheless, not as uncommon as you might think anyway. And someone's saying, please be specific in your questions, clarify state, clarify insurance companies. That's why I told you everything I gave you today was national. And that's why I did it from the standpoint of Aetna, Cigna, and then United Healthcare. Blues can be a little different, but are mostly going to follow the difference. And this is why, when I'm doing a program of this nature with so many of you, it's hard to be very specific for a state. So this is why you may want to look at our site when I do a seminar in your state. By example, this coming Saturday or Sunday, I'll be on the East Coast. We have seminars in every area, but I'm going to say the best help I can give you, allow me to be part of your practice. For $250 a year, or if you want to do it the seminar is only $500, I become part of your staff where I can talk to you on an unlimited basis. All right, I see we hit the time here, but let me see if I can get another one here. Here, someone's asking, what tool can I use to check acupuncture benefits for in-state and out-of-state? Well, when you're checking benefits, you can use a system, and most Blues have it. It's called Availity, A-V-I-L-I-T-Y. And most insurances have an electronic portal you can go through and check benefits. Phone calling is antiquated. But I'm going to give a little vote of confidence. There's a company that does acupuncture electronic health records, and it's called AcuVine, A-C-U-V-I-N-E. In fact, I'll type it into the chat here in just a moment. And while it does electronic health records, the best thing it does, it verifies insurance electronically directly from the system. So you get real-time benefits, how many are left, what's the deductible. So for me, that's worth the cost of admission for that particular one. And then someone's asking, how can you bill United Healthcare 97140-110? If it's United Healthcare, remember it's GP what you need on the therapy. And then someone's asking, why is it so difficult to get Cigna's fee schedule? Insurance companies don't give out fee schedules. That's why. If they gave you a fee schedule, if you're only billing $50 and they told you they pay $80, guess what your fees go up to? So unless you've joined them as an in-network provider, they won't provide it. I will tell you, if you join Cigna, though, in most East Coast plans now, it pays a max of 2 acupuncture sets if you join through ASH, and it pays about $90 a visit approximately. Not bad, not great. But here's what's interesting. How many of you are you aware that you don't have to belong to Cigna through ASH for them to pay you, and you get paid more money out of network than in network? So before you join something, you better look a little bit more deeper. And I think what this is bringing me to is look at the number of convolutions when it comes to insurance billing and coding. And it's the reason we do programs like this. I hope to do some more with you in the future, come to the ones that we do directly. But I'm going to say the best bang for your buck, instead of having a seminar where I talk to you for 8 hours, why don't we work together one-on-one? Go to our website, click on the network. Oh, I still didn't do that. I apologize. Let me make sure I show it to you.
And I want to
click on the network and just click sign up. Once you sign up, you're immediately in. You can immediately begin calling, so long as it's Monday through Friday. Okay, as long as it's Monday through Friday. With that, I'm going to say, thank you very much. This has been my absolute pleasure to be with all of you in this way. And I want to say to our host, Dr. Lewis, and all, thank you very, very much. It's a great opportunity for all of us because remember, our goal is always to up the profession. My biggest goal, what I want to do before I retire, which is not for another 10 years, by the way, is I want to make sure that acupuncture is fully integrated into Medicare. And here's why. It's not because I love acupuncture so much, but here's my thoughts on it. How much money would we save for people that could have direct access to acupuncture just on the cost of services, let alone the outcomes? Do you know 5,000 Medicare patients a month OD on prescription drugs? How much could we eliminate that with an alternative like with what you do? Think of how many people could use your care. And they're going to need it because Medicare is going to be hard to fund when we have more old people than young people. And so acupuncture in many ways, I think, can save Medicare. I really believe that. Anyway, again, I'm going to say thank you, everyone. I really appreciate it. I appreciate the time. I don't want to jump off. I'm not sure if you guys have an additional meeting after. So, Dr. Wei, if you could tell me where we go from here.
Oh, thank you very much. It's a very informative seminar for today. It's a lot. Yeah, I was in your seminar like in Orlando probably more than 10 years ago. A lot of things changed. And especially for right now, Medicare stuff like involved. So I think we would like to digest for today's information first, and then we probably need to continue. We'll have some either seminar or like the package you just mentioned. Like I still can connect, like talk with you or Marilyn to see what